Okay, in the essence of time, we are going to go ahead and get started. I think it's important for everyone to be able to hear what all of our panelists and speakers have to say. Cory's going to join in with us soon. And
I'm here. I'm just not sure why I'm not on screen.
well, we're going to move on. Hopefully we'll get you on screen soon, Cory. But in the essence of time for everybody that's joined us, we want to get started. My name is Debbie Miller. I'm president with the Greater Woodland Park Chamber of Commerce. And so we've brought you together to have a little update about business and about COVID-19 here in Teller County, what Teller County, what the City of Woodland Park, what the Department of Health is doing, Human Service, the Small Business Development Center, along with the Workforce Center. And then we are going to turn it over at the end before questions and Q&A to Mike Perini, who's going to talk to us a little bit about rolling out for your business in a marketing perspective in a whole new era that we've never done before. So at this time, I'm going to turn it over to Commissioner Marc Dettenrieder. Marc is our Teller County Commissioner, and Marc, I'm going to turn it over to you to give an update about Teller County and what's been going on here in respect to the COVID-19 and business.
Thank you, Ms. Miller. Thank you, and good morning, everyone. I'd like to begin with what was put out by the state. On Sunday, the governor issued the Safer at Home Executive Order, D 2020-044. This document was 6 pages in length, and let me just cover just a few of the general highlights. The Colorado Department of Public Health and Environment, CDPHE, was directed to issue a new or amended public health order. This order also advises citizens to wear face coverings in public, no public gatherings of 10 or more. Businesses are also encouraged to promote telecommuting whenever possible. They are also required to make work accommodations for vulnerable populations. And additionally, vulnerable populations are asked to stay at home. On page 4 of the governor's order, the timeline of the phase reopening is detailed. Most of you are aware of this by now, but I'll briefly just touch on it. On Monday of this week, non-critical retail could begin curbside service. This Friday, May 1st, non-critical retail and limited personal services can allow customers inside their establishments with social distancing measures in place. And then on May 4th, non-critical commercial businesses, these are the larger offices, will be opening back up, but with a 50% in-person workforce. And as you might expect, social distancing protocols are also required here. Now let's go into the Safer at Home public health order. On that same day, Sunday the 26th, CDPHE issued their document for Safer at Home per the governor's executive order. It is Public Health Order 20-28. This one's even longer, 34 pages. I'm just going to note a few areas to focus on within this document. On page 4, you will see a business requirements section. You go to page 6, under section I as an iodine, there is a list of protocols for businesses. And then if you go to the back of that document, the appendices section, you can find a very helpful piece. It's called Specific Industry Requirements. You may want to look there if you have any questions. The governor's executive order and this public health order are now state law. Now, most of you are aware restaurants are still closed for on-site consumption, also gyms, movie theaters, and casinos. The governor did say that restaurants may open up more in mid-May. I'm not sure, and there's no definitive word there. As for casinos, the governor held a press conference just on Monday, and he said that casinos will probably be closed through the end of May. So where are we in Teller County with respect to Safer at Home? So after we got that final word from the state on Sunday, the county then finalized our guidance for Safer at Home. We did receive input, much appreciated, from the cities of Woodland Park, Cripple Creek, and also Victor, so the 3 municipalities within the county. And we decided on the minimum guidance issued from the state. Now, local jurisdictions, county cities can be more restrictive. Unlike some counties out there, we will not be more restrictive here in Teller County. The 3 cities are also in alignment with this plan, so that's very good. Now, business owners do have the discretion to take more precautions, and they can adopt even more protective measures if they wish. There is a provision in the governor's executive order that says a county could apply for a local variance to be less restrictive. There is a process and a list of criteria. CDPHE has put that out. They would review a variance request, and it must meet all of their public health standards. So at the county level, right now we are reviewing the criteria for a variance and currently looking at the different possibilities to build a case based on our local picture and the facts on the ground here. For over a month now, we've had a team within the Teller County Incident Command System called Impact and Recovery that has been working on ways to guide businesses to resources among some other tasks. The Chamber, Debbie, appreciate you've done an excellent job pushing out information on your website. Resource guides for businesses and workers, they're also available on the tellercovid.com site. The Pikes Peak Workforce Center with Traci's team, and the Pikes Peak Small Business Development Center, the SBDC, with AICTA at the helm. They've also done an incredible job guiding workers and businesses impacted by COVID. Colorado Department of Labor and Employment, CDLE, you may want to check out that website. That's another good place to go for some information. I know some of the panelists here this morning are going to talk more in depth about this, but I'm just going to touch on it here briefly. On the 24th of this month, the president did sign another COVID relief package. This included an additional $310 billion in funding for the Paycheck Protection Program, PPP, and then another $60 billion for the Economic Injury Disaster Loan Program, the EIDL loans. On Monday of this week, the PPP funding did become available again. This is a loan, but it is forgivable if certain parameters are met. It is worth mentioning the first round of PPP funding did not allow small casino operators to participate, but this most recent package did open that up, which is good, obviously, for our local casinos. The PPP has helped a lot of businesses here locally, right here in the county. Local banks have helped customers process hundreds of PPP loans, so really appreciate the work the banks have been doing to assist our local businesses on this. That concludes my initial remarks. I'll welcome any questions during the Q&A. I really appreciate it. Thank you.
Commissioner Dettenrieder, thank you very much. We appreciate your time. It's been interesting as we've worked through the myriad of different things that we have to do in the different agencies that we have to work with, and we appreciate your representation of Teller County. So with that, I'm going to turn it over. Our next panelist is the Teller County Health Department's Director, Jacque Revello. Jacque, we'll give you a few minutes to talk about Teller County Department of Public Health and how busy you've been lately. We need to get you to unmute, Jacque.
Okay, sorry.
There we go. All right.
I forgot to unmute. Anyway, I didn't say anything important before I unmuted. So as you can imagine, we have been indeed very busy, but not just our department, I think everybody in the whole county. And it was really hard for me to try to prioritize what exactly I wanted to include in this short presentation. But I'll start with piggybacking on Commissioner Dettenrieder's description of the public health orders. And as you can imagine, for a public health event, it is public health orders that are trying to address, mitigate, and control this event. Who would have thought that a single cell organism like a virus could have such a major impact on our life? And I'll remind you that it's only been just a little over 3 months since that organism crossed the ocean. So it has not been a very long time, and yet the complexity of our response is indeed quite obvious. So I'll again referring to the public health orders, since they were issued a couple of days ago, you can imagine that we have been getting a lot of questions about them. We have been providing interpretation as well as guidance and education in regards to what they say. And I think that that will probably continue through their effective date of May 26th. This is a novel situation. It's a novel virus. And so the response has not only required a lot of fielding information, keeping up to date with the changes. It has been, I think, rapidly evolving, which is quite stressful most of the time when you think you know something and then they change it. So let me kind of describe for you a little bit about what we are doing at this point in the response. We know that this virus is spread through person-to-person transmission. We know that it is in the phase that we call community transmitted, which means that we've moved beyond trying to identify where you caught it. And we did that in the beginning when we were doing all the travel histories and the screening at, ports of entry like airports. And we were able to kind of try to identify where it was and then how to address that. And with the increase in cases, we've moved into it's all over. And one of our challenges has been all along the testing capability. And it's not been adequate, not only nationally, internationally, statewide, and of course, locally. So we've been spending a lot of our time trying to figure that out. There's been a limitation in the resources and supplies, the testing kits that have been available. Thankfully, to the coordination of the Teller County agencies that are responding, the procedure, the process, the how to set it up, where to set it up, none of that has been the issue. It has really boiled down to the testing supplies. And without the ability to test, we don't have the ability to accurately quantify the presence of COVID in Teller County. And so I know that's been a frustration, not only for us, but for the public, in that when we talk about that, okay, we're currently at 28 cases, we've had 2 deaths, we can't definitively tell you how much COVID is in Teller County, and that is directly related to the lack of ability to diagnose. And then the other thing that was a little bit of an issue is with the massive amount of testing that had been going on, the labs were not prepared and couldn't keep up. So our ability to get the results and to literally diagnose a positive case was delayed, sometimes up to 10 days, which again, from a medical point of view, makes it very difficult to intervene in a timely manner. Therefore, that's another reason why we've seen the spread that we've been seeing. Again, this virus is novel. Kudos to all the scientists who are sitting in their labs doing the research. One of the pieces of information that came out that made public health kind of shudder was that we know it's bit transmissible, which means it's contagious. They're saying 2 to 6 days before a person develops symptoms. Now that's always the tricky part, is that if you don't know you're sick, you don't know you can infect somebody else. And so that again is another reason why we've seen the rapid numbers that we have seen. I understand that most people don't like the social distancing orders that have been issued, but if you look at it from the microbiological point of view, in person-to-person transmission, it's a germ. This is how it's found in the secretions of your nose and mouth and respiratory system. So the typical coughing, sneezing in front of others, close enough to others, creates the exposure, and most exposures can end in infection. And so when we look at the intent and the rationale behind those social distancing orders, it's basically trying to keep people apart. And so, I support them. I understand that compliance to them has been tricky, compliance to the public health orders, compliance with public health's directives of isolation and quarantine, which is often limiting a person's movement, keeping them in their house so they don't expose others. I understand all of that is challenging. The end is not in sight, though, and when you look at the terms that they're using, like the new normal, I do anticipate that even after May, there will be some continuation of trying to prevent the spread. I don't know what it looks like, and again, that's above my pay grade as far as being able to kind of predict that, but the flexibility required in this response is, again, I think, obvious. We know there's great uncertainty with the relaxation of social distancing orders, and we need to be careful not to cause the medical surge. And you've heard that before, that we cannot exceed the capacity of our healthcare facilities and our healthcare system. And that is the reason why we have tried to implement the preventative measures. We can't stop it. We don't have prevention, i.e. in the form of vaccine. It's coming. I'll hopefully have it early next year. We don't have treatment. And so we really need to be cognizant of not creating a surge on the medical healthcare system, because that could definitely result in collateral damage. So when we look at death rates, we look at, things like ventilators. We also have to look at that if a healthcare system or facility exceeds its capacity, then people will die of things like heart attacks and strokes, because the system won't be able to handle things that they normally can. I'll just throw some numbers at you, because from a public health point of view, we are not anywhere near the peak or the end of this. And so in the United States, we yesterday surpassed 1 million cases. And I will remind you that the first case in the United States was diagnosed on January 20th. So in just over 3 months, we've had 1 million Americans die. Excuse me, over 1 million Americans diagnosed with COVID. We've had over 55,000 deaths at the national level. In Colorado here, the first case, it came into the state in early March. We've had 54 days of COVID presence in. We've had 14,316 cases. We've had 2,571 hospitalized, and 736 Coloradans have died in just 54 days. So I urge anybody who's looking at the economic impact of this to also look at the economic impact of this healthcare and how it's going to move, how that will play out as we move forward. The last thing I'll talk a little bit about is I want to kind of identify what some of the principles for decision making are. We do look at our ability to continually suppress the virus. Again, we can't prevent it. We can try to suppress it. We are working hard to increase our ability to conduct the testing and the containments. We are looking for additional protections to stay in place for those most at risk. We are looking for the ability of the healthcare system to handle the increased demand, including working with our primary care providers to implement testing within their offices. The long-term answer to testing and diagnosing is not going to be in a standalone community testing center. It's going to be with your primary care provider, hopefully in your medical home. We're going to look at sustainable social distancing policies and practices, ones that we can live with. And then from the public health point of view, the ongoing monitoring of what is this virus doing and how can we try to stay in our best efforts one step ahead of it. So I'll kind of end there, and I'll be available also to ask your questions at the end.
Jackie, thank you so much. We appreciate, can you all hear me?
Mm-hmm.
Okay.
Yes.
I appreciate so much all of your information. Getting the correct and verified information out, I think, is important. We're all hearing the rumors that are flying right now, and we appreciate you giving us the time this morning. And I know there'll be lots of Q&A for you afterwards. So we're going to move on to our next panelist, and we have with us today City Manager Darren Tangeman. And Darren, could you give us a little background on the city and where we're at with the city in regards to the COVID?
So real quick, as per the Public Health Order 2028, the city will be, in terms of its business schedule and opening facilities, we'll be putting something out probably in the next day or so in terms of moving what we've done in terms of our response from a tier 4 to a tier 3. So we'll be loosening or relaxing some of our restrictions on public facilities to allow for up to 10 individuals within our facilities. There'll be social distancing requirements within our facilities, mask requirements within our facilities as well, to make sure everybody is, and I say masks, face coverings that cover your nose and mouth, as per the public health order, so that we can all continue to do business within the city, as we have been for the last 6 weeks under a more restrictive stay-at-home order. But we'll be opening up, and if someone can't come to the city, we're still going to be providing remote assistance from a permit perspective, a billing perspective. All that will still be available to our community in terms of our facilities, our playgrounds, our picnic areas, and our public restrooms will still remain closed as per the Public Health Order 2028. We'll keep those closed, but all of the open space is still open for families, if they need to go out and recreate or get out, they can still do that, but not in gatherings greater than 10 people. So still trying to allow people to be outside without violating the public health order. So then going to what is the city doing in terms of our business relief measures, I want to just get an opportunity to highlight what those are. I'm going to share the screen and do that real quick. So we have this on our website right now. This is what the city is doing in terms of our business relief, local community business relief, residents. We have wastewater and water utility payments. We're doing it on a case-by-case basis. If someone wants a deferment, needs a deferment for their water or wastewater bills, we're offering that at the city right now. You just need to contact the number that's on the sheet here, and or contact via email, and we will arrange for that deferment for the next 2 months. That could be extended, but we're offering that right now for all businesses and residents within Woodland Park. From a business and licensing and tax payment perspective, we've waived our penalties on sales, use, and lodging taxes, which is equal to 10% of a total taxes due. So that's something the city's doing for those individuals that are who haven't paid on time. Those penalties are waived for the next 2 months as well. And you can still remit all of that online with the city. One thing I also want to touch on is something that's it's a collaborative effort between the city, the chamber, and SBDC, is that we have an SBDC grant. I want to make sure that we need to utilize for training and assistance to our local businesses. If you need consulting assistance during this difficult time to assist with modifying your business plan and or getting assistance on e-commerce for your businesses, we have this available. Let us know, and I can coordinate with Deb and AICTA down in Colorado Springs to bring up consultants up to the city or virtually meet with you on these issues. So I want to make sure everyone's aware of that resource. It's also going to entail some trainings, potential virtual training that we'll be doing in the next few months as well. And that can so those are the 3 primary things the city is doing in terms of business relief right now. I want everybody to know about that.
Okay, Darren, thank you very much. We appreciate your input. You'll be around for Q&A after as well. Our next panelist we're going to hear from is our director of the Teller County Department of Human Services, Kim Mauthe. Kim, you want to share? There's so much your department is doing. I'm not sure people here in Teller County really realize. So we're looking forward to this. Thank you.
Sure. Well, thank you for inviting me, Debbie. And our agency, the Department of Human Service, has many different roles in this event and then our normal work. We may not be open to physical walking into our building, but we are still working full force in all areas. I'll review what we've been doing with our agency first, and then I'll talk about the resources out in the nonprofit world. So we have a couple different sections of our department. Economic assistance is probably where everyone is focused on right now. And you can apply for everything online. But we provide Medicaid, SNAP, TANF, temporary aid and needy family. SNAP is our food stamps. And we don't do LEAP authorization, but we do have resources to get you to LEAP, which is the low income assistance, low energy, I can't remember the acronym. It's their assistance program for energy outreach. So so I have updates on all these programs because it's the state of emergency, have a lot of lax rules. And so for SNAP and Medicaid, they don't require as much documentation. You can apply online. You can go to coloradopeak.gov, and that's probably the easiest way to do it. But if you don't have access that way, we can go to the Tamarack building or in the Aspen Mine Center. We do have paper applications outside our door. And I would say, you know, you never know if you qualify or not. And I would really apply for any of these services because they really opened the rules to us. And so many more people can qualify than they think. Now, one key thing to remember is that any of the stimulus checks that you receive, unemployment stimulus, your tax return stuff, that does not count towards your benefits. It's only, the only thing that would count towards your benefits is your regular unemployment. And they'll define that. I believe the stimulus unemployment is $600 a week, and that does not count. So I would say, and we also provide childcare. I'm sorry about that. We do provide that service too. And then also we can help coordinate with the first responders childcare, which is another program. So that's internally. We also provide child welfare and adult protection services. These haven't stopped. We're not as busy, which is concerning for child welfare. Adult protection has been fairly busy, but you know, again, we want your reports. They still go out. We're mandated to see in investigation circumstances. We have to see clients face to face. Of course, we take all the precautions, and the county has provided us all the protective gear. So outside of that, LEAP is another program, and that one actually extended their program. It usually runs from November to April, and now it's going to August 31st. And it's a little bit more liberal in qualifications. And so, you know, I would apply if you have that need because it's a great resource to pay for your electricity or your heating bills. But going forward, that's our internal agency. Now we're looking at, we oversee all the nonprofits and are working, not oversee them, but we have coordinated them. So we're trying to use our resources the best we can. And so we're really looking at what family meets or what single person meets the qualifications for each program. In general, our assistance, like temporary aid to needy families, we can give diversions, but you have to have children under 18, you know, and there's a lot of couples or single people that don't qualify for that. And so if they don't meet our stuff, we are coordinating with the nonprofits to take up that slack. So we are really working hard with Aspen Mine Center, the Teller County Senior Coalition, Community Partnership, the Little Chapel, and the Storehouse Ministries. They're all really coordinating well, and they're trying to serve the clients as best as we can and families. So and it's all on COVID. tellercovid.com is where a lot of this information is held. One of the cool things that they're coming up with from Kathy Lauer at the Senior Coalition, I'm just so excited about this, is that they are looking at getting donations because the seniors are probably the highest risk categories that we're seeing right now. And so the Senior Coalition is delivering boxes of food to people, and they understand that the seniors are kind of feeling, you know, they're getting canned food, frozen food. And so what they're trying to do is raise funds. And they have some resources out there, but if you wanted to donate, you could call the Senior Coalition, but to buy food from the restaurants and deliver those meals for a change. so they can, utilize the businesses here, and, the seniors can get something a little bit different. I'm just trying to think of what else, any other things you need covered. We have a lot of different things going on. I have to say, working with all the different providers and all the different parts of the emergency response for the county has been great. We really have gotten to know how each agency is working together. And, I think we have some great people out there really working hard to serve the community and make sure our community needs are being met. So again, don't hesitate to apply. All these different resources have so many different programs. I can't list them all because we could be here for a long time. I would go to tailoredcovid.com, and that is a great resource for that.
Kim, thank you very much. I'm sure we'll have questions later on. So moving on, we're going to talk with lead instructor with the Pikes Peak Small Business Development Center, Cory. No doubt I'm going to mess up your last name. Is it Arcarese?
Arcarese, yes.
Arcarese, we're close. Cory.
Yeah, thank you so much. Thank you for having me. That was on another webinar. We certainly have been busy in trying to help as many business owners as we can. We have been busy and boots on the ground, trying to get as many and help as many business owners as we can, getting the word out and working with individual business owners with their individual business models in helping them pivot during this time, many of which have been closed, and trying to adapt to the new rules as they change with everything. The Pikes Peak Small Business Development Center, we have come out with webinars and with individual consultants in helping business owners with their business models, and with primarily helping them navigate the lending landscape. There's been a lot by way of lending, by way of grants that have come out. We've been helping them on several fronts. One is the lending front and navigating the lending and the grant front. If I'm going to share my screen so that everyone can see my screen here. This is the Pikes Peak Small Business Development Center's website. And you can see that on our website, we have a number of different resources here. There's alternative funding resources. We have information for reopening, information on the Safer at Home guidelines, information on the El Paso El Paso County Public Health Business Guidance. We have a Friday lunch series that is very good that I will invite everyone to. This Friday, it starts this Friday with the Payroll Protection Program. Everyone knows about the Payroll Protection Program and the EIDL. Both of those are SBA loan programs. The EIDL portal is not open right now, but the Payroll Protection Program just got a second round of funding that we anticipate is going to go very quickly again. It was opened up to more lenders. So we anticipate that the funding is going to go quickly again. And so navigating through that, we are working with many, many small businesses across the state. Okay, I don't know why I'm getting back feedback, but we have a seminar on that this Friday. The following Friday, I will be leading one on navigating online sales strategies. We are one of the centers that has actually taken a community through prior disasters because of our fires in 2012 and then the floods in 2013. So we have been helping the the state actually through some of this stuff. So we are doing navigating online sales strategies. So we invite the business owners in Woodland Park to please join us for that. And then we will be doing, after that, we will be doing the top 5 resiliency. And then on the 22nd, we're going to be doing recruiting and retaining employees. So top 5 ways to stay resilient. And on the 22nd, recruiting and retaining employees, because that is part of the payroll protection program, is to make sure that you have as many employees as you had when you started, in order for your payroll protection loan to get forgiven. So we need to make sure that we focus on that. We also, there's other SBA loans like the SBA Express Bridge loan, the 7A loans. So we make sure and we talk about that. Part of the CARES Act, there's also tax credits that you need to be aware of. So we cover that. The PPP and EIDL loans, which we talk about quite a bit. There's other resources on our page that you can learn about. There's just so much information. There's other types of loans and emergency funding that you can learn about on our pages. There's specific industry information that you can learn about. There's information in Spanish. We have consultants like myself that speak Spanish. If you have any Spanish-speaking business owners that need help in Spanish, we're happy to talk to them and try to get them the information that they need. Other region resources is on here as well, that I will point out on here. Information. We also have resources and videos and webinars. We've recorded application instructions on how to fill these out. I've recorded several of these. CARES Impact, keeping your business together, the Paycheck Protection Program, and we've even recorded one in Spanish. And all of these live on our website for the Pikes Peak Small Business Development Center. So we are also working on several programs, one of which is coming up, that Coffee with the Director, and that will start on Friday mornings here, coming up pretty soon with Ekta. We're absolutely, we're trying to multiply her into 5 people. So just because we are trying to get out as much information as possible. There are loans and grants for artists. There are for minority and women-owned businesses. We are the central hub and go-to place for training, for information on loans, and for grants, for businesses that need information. So if you have any businesses that need information, whether it's on insurance, on business insurance, we have the information here. You can see business interruption insurance, how to advocate for themselves. If they need to speak to a consultant, financial consultant, on how to rework their projections for the end of the year, how to fill out a loan application. If they're interested in doing government contracting, we are the central hub for them to go to and for them to talk to a consultant. So I highly encourage anyone who is working with a small business, or who has small business and the small business has a question, or is encountering any issues or problems. And if they are have any questions, or they need to speak to a consultant, and they are having questions, whether it's about loans or grants, or they need assistance, please send them to the SBDC, and we will find them. We will connect them with somebody who can help them. We have volunteers, we have paid consultants, and we have resources for them to be able to get some help. There is no reason that if they're a business owner anywhere in El Paso or Teller counties, they can't get the assistance they need through the SBDC. And I will be available for questions and answers here. But I would say to start at the Pikes Peak website, there is a tremendous amount of information. We update it daily, several times a day, and we have information, and we can get them to the people that need to talk to them.
Cory, thank you very much. The Chamber loves partnering with the SBDC. Commissioner Dettenrieder mentioned about our pages we have on the Chamber. A lot of that is the similar information. Darren mentioned about the grant as well. So we'll move on to our next panelist. And Cory, thanks for sticking around. I'm sure we'll have Q&A after. Our next panelist is our Executive Director, Traci Marques with the Pikes Peak Workforce Center. Traci, I know you had to jet about town. You were just on live with Fox 21, and we appreciate you joining us here and filling us in about the Workforce Center and what's happening there.
Great. Thank you. Thank you for having me. First of all, Debbie, I have to give you and the Chamber of Commerce of Greater Woodland Park kudos. You have done a fabulous job in getting the information out, and it's your partnership and it's the reach that you have in your community that has allowed us to be where we are now and being able to be safer at home. It's what you're able to do for the businesses in Teller County that is so appreciative. So thank you very much for your partnership and your continued support. You know, I just love you. So on to the Workforce Center. You have to, right? You need partners. You need partners. So with that Pikes Peak Workforce Center, we are the American Job Center. We cover El Paso and Teller counties. What we do, you know, actually let me back up a little bit. Workforce centers have been around since the Great Depression. We were designed in the 1930s to really help mass unemployment. How do you handle it? How do you deal with it? How do you retrain? How do you get the talent that businesses need? And how do you get people back to work? During this pandemic, it's changed completely. We're seeing record high unemployment numbers. You know, there's different industries that are really struggling right now, but there's also industries that are really growing right now. And it's an interesting place to be in. As we start to reopen, a lot of questions that we're getting is how do I get my quality workers back? How do I retrain my job seekers? How do I, you know, find people to open the business and provide the services? Those are a lot of great questions that really have not yet been answered necessarily. The best resource for anything with business owners, as far as what are your legal rights, if your person has filed for unemployment and you want them back, but they don't want to come back because of COVID-19, there's some great resources on the Colorado Department of Labor and Employment website. We can send that out to you. They have great questions. It's updated daily. And to be honest, that's where a lot of the workforce centers get all of our information, because it's one centralized point. As Cory mentioned, you really need to make sure when you get information, whether it's for a small business development center, with the workforce center, you really need to make sure you have reliable, trustworthy information. One of the opportunities that we have now, and it's hard for businesses to think about this, is there's dollars coming in from the federal government as far as how do we help retrain the workforce that we have now. We've talked for years, what's the future of work? We've talked about 30% are going to be gig economy workers working from home, freelance. You know, we went to the future of work pretty quickly within a couple of weeks because of this pandemic. So look at that as an opportunity. I know it's hard as a business, you're struggling, you're not making money, but if you could retrain your workforce for the future of what you want your business to be, how would you do it? Be innovative, think outside the box, and then contact us, contact me at the Pikes Peak Workforce Center, because we have federal dollars to be able to help retrain your workforce. They're called dislocated worker dollars. We have some emergency grants that the state has received to really help you retain and regain your workforce. And why not use this opportunity to upskill them? if you're in retail and you're doing now more online retail than you've ever have, what type of cybersecurity protection do you have? Can you use this time now for you yourself as a business owner to get some training in cybersecurity, so you and your customers are safer being able to, market on the internet? So there's a lot of other opportunities that you can do right now. I know it's very much a struggle, especially with unemployment at records highs in industry, and really looking at the resources that you have available. If you're looking at layoff strategies, let's say you've been able to survive so far and you're looking, well, I may have to reduce my staff. The business services team at the Pikes Peak Workforce Center is here to help you and walk you through some of those different options that you have. We're also starting at the end of the week our Teller County virtual job fair. There are companies that are still hiring in some occupations, and let us look at those. If you're looking for work, look at the virtual job fair to see who's hiring. And then also, if you need to start regaining your staff, or you don't have staff, you need them, look at the virtual job fair as an opportunity for you to advertise your positions. All services at the Pikes Peak Workforce Center are at no cost, either to job seekers or to businesses. So thank you, Debbie.
Tracy, thank you very much. I know there's going to be some questions after. I've reached out to you from some employers about some things. This is all new as we try to bring employees back. So we'll move on to our final panelist, and then we'll do Q&A. One of the things for those that are listening, you can type your question in under Q&A, or if you'd like, just let me know that you have a question and I can unmute you. But with our final panelist here today, we have Mike Perini with Perini and Associates. Mike is our marketing guru here in Teller County. And so Mike, I know that businesses are concerned about, as they open, how do they market responsibly? So I'm going to turn that over to you, Mike.
Well, thank you, Debbie, and thanks for setting up this webinar and for the opportunity to share some insights on how to communicate a business or nonprofit reopening. First, I just want to say that we at Perini and Associates are so sorry for everyone who has been ill and or had a loved one die due to COVID-19. As some of the panel members have already said, sharing reliable and trustworthy information is important during a crisis. Having a plan to successfully reopen depends heavily on the communication strategy and the activities that are developed. Now, lessons that I've unfortunately learned from past experience as a senior public relations practitioner during 9/11, Hurricane Katrina, forest fires, and other crisis situations, it has definitely taught me a critical lesson that communicating to employees, stakeholders, news media, and the general public is important. I know due to COVID-19 that many are frustrated and stressed, and as a result, the amount of information that your customer can understand and remember at one time needs to be communicated in clear and concise, simple ways. There is a need to provide hopeful and caring messages and dialogues with employees, customers, and the general public going forward. One thing I want to say right at the start is always be truthful. The fact that you are likely operating on a very meager budget, the ways you can communicate your reopening needs, we need to figure out what tools that you can use that are not so time-consuming in human resources and financial expense, and I get that. So I'm going to provide you some ideas here in the short time that I have. I would also like to offer other examples of what you can do if you do have a marketing budget, which of course I would recommend, to really accelerate any information getting to customers as you reopen. First, be intentional about telling the public that you are reopening. This is not the time to be shy. You want to shout it off the rooftops. Second, be sure to inform customers about your safety measures. This includes mentioning hand sanitizer, masks, no more than 10 customers at a time, and social distancing, requiring that tables are 6 feet apart, etc. Whatever the state, county, city, and public health guidelines are for you to reopen. These need to be visible and made clear so that people feel safe in your business. Now for some specifics. I'm going to cover these quickly for those of you who might be taking notes, but would be willing to provide additional details when we get to the Q&A. Also, you're going to find this list on the website later today at periniassociates.com. So let's start with, you ready for the first one? Each day, pick 3 phone contacts to text or call about reopening. Each day, have your employees make 3 phone calls or texts to their friends, their family, and those they already connect with about the great reopening news. Many of you have voicemails for your business. We'll change those voicemails now. Come up with a message that you are opening with dates and times. Because most people don't like long answering machine messages, and I'm one of those. Direct them to your business Facebook page or website, or even have a flyer in the window that has more details. And speaking of flyers, these can be easily designed and are very inexpensive to generate. Post them around town. There are many places where flyers are accepted. I would suggest that 8.5 by 11, the regular paper size format, so other businesses can also have space to communicate their reopening plans. Now, if you belong to a church or any community organization, share your reopening information with them at least 7 to 10 days in advance, if you can, and ask them to share it with their members. You can also send the information about your reopening via email and ask others you know to do the same. If you're on social media, then place a post on your page and on the Teller County and Woodland Park groups. There are many to choose from up here. And be sure to ask all to share. You can also take photos of your preps to reopen and pass them along as you're cleaning and working and doing all those things. This is what we call generating buzz, as we say in the marketing world, and it will encourage conversation about your business. And yes, if you have a website, place your announcement on the front page. Make sure it's large enough for viewers to see right away. I would also suggest you call the local media and tell them that you are reopening. This is a hot news topic, and you are likely to get positive exposure, reaching many people that you would not likely have been able to do so efficiently. The reporter might even want to cover your first days back, and you should encourage that. Now is the time to think about signage. We are open. Signs displayed prominently either in windows and/or with yard signs and/or with banners. For example, we know of a local business owner who's going to display a vinyl limited menu in her front window. Along these lines, you should have an employee stand out in front of your storefront with a sign indicating that you're again open. Now, this is really popular here in Woodland Park, as you've seen it over the years. You could also offer some discounts and some meal specials for the first week or so to build your return business. One local restaurant we know about here in town is going to offer family meal deals. Again, I'm trying to keep these ideas at little to no cost, but buying an inexpensive Facebook ad to announce openings, specials, and days and hours is also something you should consider. And you can do this for just a couple of dollars a day with really good targeting results. If you're a chamber member, you should create a post for the weekly grapevine. It goes to many beyond just chamber members and is an excellent way to promote your reopening. There are many electronic community boards out there where you can post short announcements for free. But look, if you have a budget for paid advertising, then yes, you should consider print, radio, TV, and online. Again, as I said at the start, now's the time to plan to communicate. If you take action now, then you will be rewarded with customers returning sooner. Finally, I would be interested, as I'm sure most of you would be, if any marketing ideas you might have to pass along to those on the webinar. Again, I'm sure they would appreciate it. And Debbie, thank you, and back to you.
Mike, thank you very much. Some great tips and specific tips I know that businesses here in Teller County have utilized before, but certainly need to utilize. There we go. Are you hearing me now?
Yes, I hear you.
Deb, I can't hear you. I think you may be muted.
Okay, Jackie, how about now?
Now I can hear you.
All right.
And if I might, in the interest of time, if there are any questions for me that I can take, I will need to sign off shortly.
Okay. This first question is for you. When you know you've been exposed to someone who tested positive, do you have to wait until you have symptoms before you can get tested?
Okay, so if you have been exposed to a confirmed case for COVID and that case lives in Teller County, Public Health is notified of that case. And then we do what we call contact tracing, which means we contact any individuals that infected person has identified as contacts, and we will place them in quarantine. So if you, my question is how was that person lab confirmed? Do you know for sure that they are positive? Were you in close contact, which is simply defined as within 6 feet? Then you should self-quarantine, which means you're not sick. You may have been exposed, but we want to separate you so we can monitor to see if you become sick. If you develop symptoms, then you definitely possibly could have been infected. And at that point, we would recommend testing. Because of the limited testing supplies, we are limiting the testing to high-risk people, healthcare workers, first responders, and community members who have symptoms. So you have to have symptoms to access a test. So if you develop symptoms and you've been in contact, then yes, you should be tested.
Okay, Jackie, thank you. The answer was it's not a Teller County situation, but she appreciates the answer to that to understand, because, you know, it's not like that virus stops at county lines.
Right, and I would emphasize again, if you really do know you've been exposed, then you should self-quarantine and take yourself out of commission here for a while, at least for the 14 days, to see if you do develop symptoms, which means you are infected.
Okay, great. Do we have any other questions out there? I know that we have a couple of press on here with us. Pat, I'm going to allow you to talk at this point. Is there any questions you have, Pat Hill? Pat may not have her.
Yeah, can you hear me?
Oh, we can hear you, Pat.
Okay, yeah, I don't have any questions right now. Everything's been great so far, thanks.
Okay. All right, thank you. I know that we have another question coming in. When, and Jackie, this is for you, when is Teller County going to get more testing available?
Yeah, we're really hoping this week. We've been working on this so diligently, and again, our challenge has been accessing testing supplies, and that's the only challenge. We have the plan. If anybody remembers, a couple of weeks ago, we did open a community testing site, unfortunately only for 1 day because the testing supplies got redirected, and that it was perfectly appropriate for that to have happened. So we are ready. We are just waiting to receive more testing supplies. So we are hoping for this week. And I will clarify, though, that the testing will be focused on people who have symptoms. You can't just get tested because you think you've been exposed or whatever. And again, that we're not to the level yet where we have enough testing supplies to test people who don't have symptoms.
So Jackie, that is a question. Eventually, will Teller County be able to get to the point for testing if people just want to be tested?
That's the hope. That's the hope and the goal. And again, you know, we're going to do some work with our primary care providers to remove any barriers to their being able to test their patients. And ultimately, when you think long term, it's kind of like you can kind of compare it to the flu. You don't have to go anywhere else but your provider's office typically to get tested for the flu. And so that's a best practice, and that's what we're hoping to support.
Okay, great. Rick, you're here with us from the Mountain Jackpot. Do you have any questions? I've allowed you to speak at this point.
Can you hear me?
We can hear you, Rick.
All right, this is a question for Marc. Marc, what about the casinos? Teller County obtaining a variance to reopen the casinos a little quicker.
Thanks, Rick. When we go through this process of evaluating the variance process, we will definitely take into consideration the casinos. They are going to be on the list.
Oh, okay. So when you know when that will be? When will Delaware County probably get a variance together? Is that something on your schedule?
We have no definitive timeline in place.
All right.
now.
Okay. Okay. All right. All right. That's all the question I have. Yep.
Okay, Rick, thank you very much. Jackie had to sign off at this point. She had to move on. Do we have any other questions? I'm going to pose a question while I'm waiting to see to Traci. Traci, we are at the Safer at Home part now. And with a Safer at Home, employers are beginning to call their workers back to work. I reached out to you. There are some questions in regards to what happens that they need to do if an employee says to an employer, I'm scared, I'm not sure about going back to work.
You know, there are some great resources, and I put up the link in our chat box too for people to copy down. As far as you're trying to get an employee, you know, back to work and they're scared, there are, you know, there's certain things that you can go to from, and you're paying unemployment, they're receiving unemployment. There's some, you know, forms that you can fill out, and you can, you know, kind of file for that as a business owner. But in reality, sometimes it's about relationships and human touch, and picking up the phone and talking to people and saying, well, what are your concerns? And being able to work through it could avoid a lot of this legal mess that could potentially be. We don't have actually guidance as far as legally what's required, what they can and can't not do. Small businesses don't necessarily have HR managers and HR department, but really talk to some great resources, experts up at the state, and some different associations that you can contact with to get some guidance on it. But you know, all else fails, there is some claims process you can go through the unemployment division at the Colorado Department of Labor and Employment. But I suggest my first step is really just to virtually sit down and have a conversation with them and find out why, and see what you can do to help mitigate some of those potential concerns that they have.
Okay. At the bottom of your screen, again, if you have a Q&A, if you have a question, you can click on that real quick. I know all of our panelists are very busy. I know they have probably other Zoom meetings to go to today, without a doubt, and we want to be very respectful of their time. I don't see anything coming up in chat, and I'm not, Lori's saying, thank you, Chamber and panelists, for your time and information. You know, we are thrilled to do this. You know, some of the bigger chambers have been doing this for a while. Up in Teller County, one of the things we know is we like to get together in person. So this is our time of trying our Zoom meetings and doing it this way to be safe. And so with that, I'm just going to reach out and say thank you to each and every one of our panelists for giving your time. Mike, you had some great information for the businesses as they roll out. Marc, I know there's some concern about the casinos. Thank you, Kim. I know you have so much information from Human Services of what you do. I hope that those that were on here today will share that with their friends and family. Cory, thanks for stepping in for AICTA. SBDC is such a great partner, and we love working with them. Traci as well. We go way back, and thank you so much for everything that you do to help us up here. And Darren, we appreciate the city's perspective today. This won't be our last one that we do. We're going to be